Hey there, and welcome to Sciatica Reliefs Now presents Kicking Sciatica and Piriformis Syndrome's Butt. Thank you for taking me up on watching this webinar. My hope is that you gain a lot of insight and learn quite a bit through this presentation. So before we get started with the information, let's see who this webinar is for. This webinar is for anyone who is dealing with sciatica or piriformis syndrome issues. This is for you if you're frustrated and feeling hopeless because you haven't gotten any relief or not enough relief from your pain. This webinar is for you if you're feeling overwhelmed, overlooked, and not taken very seriously by the medical professionals that you're seeing and or your friends and family. This webinar is for you if you have not found significant relief from the treatments that you have been getting. This webinar is also for you if you have been missing out on doing the things you love with the people who mean the most to you. This webinar is for you if you want understanding as to why what you've been doing has not worked. And it is also for you if you are serious about wanting real help, real answers, and real relief. If that describes you, you are in the right place. This webinar is not for you if you are not serious about wanting relief. This webinar is not for you if you're thinking there is just a real quick fix to your problems. This webinar is not for you if you're feeling like nothing will help and you're just here to prove that this is just a waste of your time. This webinar is not for you if you believe you do not have to work at getting the relief that you deserve. This webinar is not for you if you're fine with missing out on doing the things that you love with the people who mean the most to you. This webinar is not for you if you just want to keep doing what you have been doing, because if you do that, you're just going to keep getting the same results. And if you're here, it's probably because you're dealing with issues that you have not sufficiently resolved. This webinar is not for you if you are not serious about wanting real relief, real help, real answers. So what is my goal for this webinar? The goal for this webinar is to give you as much information as possible so that you can make the best decision possible for yourself about your health and how you're going to move forward with taking care of the sciatica or piriformis syndrome. And I want you to have the confidence to know what you need to do from here on and how to find the best possible solution so you can get on the road to recovery. And with all that being said, I'm just putting out there, this is an assumption alert. I'm assuming that you are not satisfied with what you have been told or what you have been doing thus far for your sciatica or piriformis syndrome. And I'm assuming that because if you're still listening, I'm just assuming that you're still having problems. Do any of these stories or issues sound familiar to you? It all started slowly with an occasional discomfort when I would get out of bed, when I would do yard work or housework, when I would go work out, when I would go for a walk, when I would play tennis or golf. But over time, it became more and more intense and consistent. Initially, I noted some stiffness in the mornings, and over time, it would get stiff and sore after sitting for a while, and now the pain and stiffness is constant throughout the day. I noticed pain in the morning, but the more I'm up and around, the better it felt. But if I'm up and around all day long, by the end of the day and the next morning, it's significantly worse. I felt a twinge in my back, and it has progressively gotten to a constant nagging ache. It's only my leg and my foot that are problematic. Occasionally I have a problem in my butt, but my back feels fine. I can be very active. I can work out, I can bike, I can run, I can do most of the things that I want to do and that I love to do. But an hour or two later, or maybe even the next morning, I suffer the consequences and the pain is unbearable. Laying down and sleeping is absolutely the worst, and I just cannot get comfortable. My symptoms came on all of a sudden, or from just a slight movement, or I just woke up with this severe pain, and it has been relentless and problematic ever since. Once again, I want to thank you for being here. I want to give you a quick introduction to who I am, working with clients up here on the top left screen, working with this very sweet lady, and this is Betty White. It's not the Betty White, but when she told me her name, I said, I've got to get a picture with you if you don't mind, and can I please use it to tell people that I got to treat Betty White. The bottom left-hand corner, my boys are about 5 and 7 years old. Here are Ben on the right, Jesse on the left at Ben's graduation from College of Charleston. Here we are a couple Christmases ago in Charleston. Right now, my boys are 26 and 24. I am over 50, and my wife is still very young. Here's my wife, Trudy, and myself. And here is an amazing man. He's 90 years old in this picture, a World War II and Korean War vet. Just a humble, gentle, sweet man who's doing amazingly well for 90. And here's me doing a workshop in one of my clinics in North Carolina. So who am I? Well, my name is Dean Volk. I am a physical therapist. I received a Master's of Physical Therapy degree in 1992, and a physical therapist in the United States is a physiotherapist in most other parts of the world. I've got 26 years experience. I graduated with a master's degree, which is a 3 years postgraduate degree. In order to become a therapist, I had to pass my national licensing board exams in order to practice as a physical therapist. I currently have 2 physical therapy clinics near the Charlotte, North Carolina area, and a concierge practice in Charleston, South Carolina, as well as an online business where I help people dealing primarily with sciatica and piriformis syndrome overcome their problems. Who am I? Recently, as of November 2018, I became an author of Sciatica Relief Now, available on Amazon. I'm a health and wellness writer for the Charleston Mercury newspaper. I also write sports medicine and rehab information for Charleston's Oblique magazine. I'm now a special guest there. I used to do it in every publication. I also write for health and wellness for the Independent Tribune, which is a newspaper just north of Charlotte. For those of you in the UK, this person on the right may look familiar to you. He is Paul Goff. He is a leading physio in the United Kingdom. He owns multiple private practices, I believe 4 of them, in Northern England, in Hartlepool, Darlington, Durham, and Guilsborough. And he endorses me as the go-to physio for sciatica. I actually cared for a member of his staff through video consultations. And now whenever they run into issues with piriformis syndrome or sciatica, Paul tells their clinic to get in touch with me, and I take care of their clients through video consultations. He's the author of a number of books, but The Healthy Habit is the most known in the UK. He has several PT business books. He is a sought-after speaker all over the world on physical therapy business. He writes for numerous papers in the UK, and he's a regular panelist on the BBC. So let me ask you, have you ever heard yourself say any of these things? I don't know why I'm going through this. I don't know what I did. There's absolutely no comfortable position. Nothing is helping. I'm scared to move too much, but I get stiff and sore if I don't move. I didn't do anything to cause this. It hurts all the way from my butt to my ankle. Any little movement is excruciating. I cannot find a comfortable position. If I could just get a little bit of sleep. And now it's full confession time. Back in, I believe it was late April, early May of 2018, at 2 in the morning, my wife started talking, saying, I don't know why I'm going through this. And as I woke up, I said, what did you say? She goes, I don't know why I'm going through this. I don't know what I did. And with that, I jumped out of bed, ran to my computer, and started typing down these 10 things verbatim, when she said it, how she said it, so that I can get a handle and an understanding more so of what people typically go through when they deal with sciatica. The morning before this, my wife woke up and started walking like a 90-year-old woman, telling me that it hurt from her butt to her heel, and she would shuffle. And from that time on, this was about 3 months after I started working with people online on sciatica. And initially I thought she was pulling my leg, just testing me. But when she started walking and shuffling her feet like a 90-year-old woman, which is extremely out of her age range, I took her seriously. I said, look, we've got to get doing some things. And she said, I can't do anything right now. Leave me alone. It took her about 10 minutes to walk a very short distance to our bathroom, about 10 minutes to walk the very short distance back. She got into bed. And I said, look, I know it's painful, but we're going to have to start doing things. And over the next 2 days, as she started listening to me, telling her what to do with the treatments that I use, she was up and around. By the third day, she wanted to go out for a walk. She typically walks 7 to 9 miles a day in Charleston, South Carolina, but I said, you cannot walk that far. You've got to take it slow. You've got to shorten up your step lengths and another number of other things. And within a week and a half or two, she was out walking 5 to 7 miles, and she has not looked back since. So if we're going to talk about sciatica and piriformis syndrome, let's get a quick, brief overview of what exactly sciatica is. And these pictures may look familiar to you. You may have assumed these positions at one time or another here in the recent past or in the distant past. But in order to understand what sciatica is, we must understand what the sciatic nerve is. And the sciatic nerve is a nerve that is made up of 5 different nerve roots that come from L4, 5, S1, S2, and S3, which stands for lumbar level 4, lumbar level 5, sacrum level 1, 2, and 3. You can see those nerves coming out of the spine, and they form a thumb-like thickness, a medium-sized thumb thickness nerve that runs right in the middle of the butt. It goes down the leg, then moving to the picture on the right, you can see it goes down the back of the leg by the hamstring muscle, and it splits right above, behind the knee into two nerves, one called the common fibular nerve and one called the tibial nerve, and the nerves run all the way down into the feet. So what is sciatica? Sciatica is a generic name, although it definitely does not feel generic, for any irritation anywhere along the sciatic nerve. Sciatica is really not a true diagnosis. It is a symptom of a problem, a symptom of the nerve being irritated and pinched. And on the right-hand side here, you can see the 3 major areas that are most typical of where the pain or symptoms are: in the back of the hamstring, in the back of the calf, and then the lateral part of the foot. But sciatica can be anywhere from this low back region all the way down through this green nerve here and wrap around to the front if it is on the common perineal nerve. Symptoms can be pain, jabbing pain, shooting pain, electrical light shock pain, tingling, numbness, deep ache, anything that you can assume or think of what a nerve irritation or muscle cramping or any discomfort feels like. You can have that anywhere from your butt down to your foot. So now that we know what sciatica is, what exactly is piriformis syndrome? And for those of you who are very observant on the pictures before, we're going to use the same picture here. The piriformis muscle, I highlighted it. It is a little muscle. It's a decent sized muscle that runs from the top of the hip into the sacrum bone, and you can see how close it is to the sciatic nerve. And here I just drew it out and blacked it out. Here on this right side, you have to take away the gluteus maximus muscle. And here you have this piriformis muscle right below the gluteus medius muscle. And you can see again the proximity to the sciatic nerve. So what is piriformis syndrome, or PS for short? Piriformis syndrome is an irritation of the piriformis muscle which causes pain, whether from an injury, a muscle spasm, muscle tightness. Any problem in the piriformis muscle can be classified as piriformis syndrome. The symptoms of piriformis syndromes are severe pain in the buttocks and hip, but due to the proximity of the sciatic nerve, symptoms can actually mimic the sciatica symptoms of pain, numbness, tingling, and electrical light shocks from the butt to the toes. There have been studies out of the sciatic nerve that show about 80% of the time the sciatic nerve runs below the piriformis muscle. In 5 to 10% of the population, it runs above the piriformis muscle, and in 10 to 15% of the population, that sciatic nerve pierces right through the muscle belly. So now that we have the definitions and the understanding of sciatica and piriformis syndrome, I got to ask you, which of these makes your back or leg pain worse? Is it standing, sitting, laying down, or twisting? How about leaning backwards, walking, or bending? Or is your pain constant and unrelenting? And any of those 7 things on the top of this page can increase, decrease, or change your pain at any given time, depending on what is causing the sciatica, what's causing the pinching, what's causing the piriformis syndrome. Typically for piriformis syndrome, when you sit down, because that muscle, I like to think of it as sort of like a hammock. As you sit down, you are putting pressure on the inside of that hammock as you sit on it. And that's what the piriformis muscle reminds me of. So when you sit on a muscle, if you sit on the piriformis muscle, when you are dealing with piriformis syndrome, it typically is pretty painful. And you can typically put your hand right in the middle of your buttocks, dig into it, and it will light you up in pain. What is the biggest mistake that most people make initially once they start having these symptoms? The biggest mistake that I see from most of my clients is they tend to ignore their pain and symptoms simply because they believe it's just going to go away. It's a little irritation and a nuisance that they have to deal with that will go away on its own. If that's you, I totally feel for you, because obviously it did not go away, because that's why you're here. So what are the 3 most common causes of back pain and sciatica? Number 1, it's the bulging or herniated discs. Number 2, stenosis, DDD, which stands for degenerative disc disease, or it could be DJD for degenerative joint disease or arthritis. And the third is SI, or sacroiliac joint dysfunction. And I'm wondering how many of you have been diagnosed with one of these 3 things. Or you could have been diagnosed with some hip bursitis, hamstring bursitis, lumbar pain or strain, or a hip labral tear. So many different things can be diagnosed along with sciatica or piriformis syndrome and be interrelated. And these are the big 3 that are typically diagnosed with scans. But there are some amazing studies that are coming out that should give you some hope if you've had these scans and you've been sort of depressed because of what they have found. Before we get to those, I just want to talk to you about the typical path of most of my clients. If they go to a GP or a family doctor, they're typically given some type of medications, whether it be anti-inflammatories, pain medications, and or muscle relaxers, and they're possibly handed an exercise sheet of generic stretches. These stretches are generic because they're both for flexing, bending over forward, and extending, going backwards. And one of those motions probably will help you. The other one probably will hurt you. Doing them both together, you have no idea which one is doing good and which one is doing bad. So that's why I call it generic, because it's not specific to the person. It's just a generic sheet of exercises that a lot of doctors' offices just have ready for people to use. If there's no change after seeing that doctor and getting the medications or the generic exercises, oftentimes there is not any change, and they're either referred to a physical therapy or they go straight to a specialist, either an ortho surgeon or a neurosurgeon, depending on their symptoms. If they go to PT, they're often given activities that often tend to aggravate their symptoms by stretching, foam rolling, and digging on the painful side. A lot of times you will find that those are the exact opposite things of what you should be doing, and we'll talk more about that later. Or if they go to a specialist, they may get a scan ordered, or medications may be changed up, or they may be going in for injections. Other people try chiropractic care, osteopathic care, massage therapy, and the acupuncture route. Most people, by the time they see me, they tell me I've tried everything, from everything listed above to icing and heating, using a TENS unit, doing tennis ball or foam rolling, doing stretches, doing yoga, etc. And oftentimes, if someone gets an MRI, it is shown to have degenerative joint or disc disease with some bulging or some herniations, as well as some bone spurs and stenosis. And this messes with people's minds because they believe that that is the cause of their pain. But just think about this. A scan itself does not show pain. It just shows what is there. We'll get more into that in a moment. Many of my clients have literally spent thousands of dollars on care at chiropractors' offices, getting a decompression table treatment or total packages costing anywhere from $2,500 to $3,500. They've also spent all that money with physicians, medications, scans, yoga, acupuncture, basically trying to get rid of the pain. And guess what? I don't blame you. I don't blame them. When you're in pain, you are desperate to get relief because sciatica and or piriformis syndrome can be excruciating. But if you've had those scans, if you've had things that basically show a diagnosis of degenerative disc disease, degenerative joint disease, bulging, herniation, stenosis, something going on in your spine, I have some really good news for you. Actually, I lied. It is great news for you because if you have disc issues in your back, I just want to tell you a couple of things. First of all, the following slide is going to show stats of people who have MRI findings that are typically worse than most of my patients, but they have absolutely no symptoms associated with it. Also, there are a lot of recent studies that are coming out showing that disc issues can resolve on their own. Whether the disc reabsorbs its own leakage or the body detects the leaked disc as a foreign substance and attacks it, or it could be that there's a decreased water absorption capability of the disc itself so that injured disc shrinks back in size on its own. But it doesn't matter what the reason is, the result is a definite decrease in the size of the herniation and or bulge. And what studies are showing are the more significant, the more severe the herniation or bulge, the more likely it will resolve on its own. And now for the stats that I was telling you about, and here are some eye-opening statistics. And what I'm going to do is I'm going to start at a 40-year-old because most of the people who come to me are 40 or older. And look at that, 68% of the people in this study had disc degeneration problems on a scan. So they would go to the doctor, get an MRI, 68%, almost 7 out of every 10 people, 40 years and older, have some type of disc degeneration going on, and they have absolutely no symptoms. These are with asymptomatic patients. More than half the people have disc signal loss or disc height loss. This basically shows that the disc is losing its water absorption capability, and 50% of the people age 40 have disc bulges but absolutely no symptoms. And as you get older, you can imagine 80% of 50-year-olds have disc degeneration, 60% have disc bulges, and it just gets worse as you go on. So having a disc bulge or having disc degeneration is similar to saying, hey, you know what, you're getting some gray hairs. Hey, you know what, you're getting some wrinkles on your face. You know what, you're losing some hair at the top of your head there, mister. Guess what? That doesn't mean you have pain. That doesn't mean there's a problem associated with it. That just means that is a normal aging process, which we are finding in the spine, that bulges, herniations, protrusions, disc degeneration, disc joint degeneration is a natural aging process that doesn't necessarily cause pain. I'm going over these stats for a moment, and please hang in there with me because there's a reason why I'm showing these to you. The reason I showed all these to you is just so that I can give you a little bit of hope, so that you know that just because you may have an MRI that is not normal, it does not mean you have to live with pain, because that MRI is not showing pain, it's showing the normal aging process oftentimes. Now, I am not saying that if you have a herniated disc and it's hitting against a nerve that that is not the cause of the problem. But if you know anything about what's going on, and we'll talk about this a little bit later, when you have any type of irritation or pain in the body responds in a way that can actually be causing more pain as it tries to protect itself. So remember, these statistics right here are of people who have absolutely no pain. So take a little bit of heart, take a little bit of hope, and take a sigh of relief to know that, hey, just because you have findings on your MRI, it does not mean that you have a problem. So overall, I want to talk about a couple things. What makes us different? Typically, when you go to a physical therapist, a chiropractor, a trainer, a doctor, a massage therapist, or any type of a health professional, and you have sciatica or piriformis syndrome, they are generally going to tell you and show you and do for you stretching of the painful side, which, from my perspective, further irritates an already irritated muscle, tendon, nerve, and overall tissue. So what makes us different? What makes us different and what makes me different in the way and the methods that we use is a treatment technique called total motion release. It's a technique developed by what happens to be now a good friend of mine. His name is Tom DeLonzo Baker. I've known him for about 12 to 15 years. I took some courses by him, went through all 3 of his courses, have been using these treatment techniques for the past 12 years, amazingly successfully on my clients, especially those with sciatica and piriformis syndrome. So let me explain a little bit about it. Whenever there is a pain, stiffness, tightness, soreness, or discomfort anywhere in your body, because the body is amazing at continuing to function, it naturally compensates for itself, which causes a natural imbalance. An imbalance meaning some tightening and loosening of muscles compared to their normal state. What I do is I focus on clearing out these compensations first before attacking the issue. Because to me, if you start working on the issue itself and you're causing more pain, if you look at the top sentence there, if you're causing more pain or tightness or soreness with your treatment, the body's going to compensate and further cause imbalances and cause further problems. Think about it like this. If you've ever noticed somebody who's walking on a severely sprained ankle, they're hobbling. Say it's their right ankle. Their right foot's not on the ground as much, which means that their left leg is bearing more weight than normal. And because the right ankle is sore, the right foot's going to hit the ground, and the knee and the hip on the right side are going to have to take up more weight than is normally they're normally accustomed to, because the ankle's normally absorbing some of the weight, so it gets transferred to the knee and the hip and the low back more so. But the opposite side of the body is definitely taking on more weight because it's on the ground longer. But as they're walking, they're shifting their whole body. Their shoulders are jerking, their arms are jerking. Everything is out of balance. Everything is compensating for that ankle. Let yourself use that as a big picture for what goes on a smaller scale. If you have a pain anywhere in your body, guess what's happening to the muscles and under your skin while there's a pain, stiffness, tightness, or soreness? Your body is compensating for itself. You may not be able to see it. You may not be able to recognize it, but it happens as a natural response to pain. So what I do, like I said above, I try to clear out the compensation. So how do I do that? I find what is comfortable, what's easy to move, and what is not painful, and I focus on those activities, because this tends to relax the body, eases tension, and it calms symptoms. So by doing this, I'm avoiding painful motions, because if you use painful motions to try to decrease pain, you're basically causing your body to guard, tighten, and cause other parts of the body to compensate more, and they're either going to overwork or underwork depending on what the issue is, which is going to cause more compensations, which is going to cause further imbalancing and abnormal movement patterns, which further aggravates the underlying tissue. So my goal is, with my treatments, I want to find what works and move what works and compare then afterwards how you're feeling. And there's usually no quick fixes, but I do want to share with you some stories of some clients of mine. And I just want you to read what others are saying after a free video call with me or after starting a course that I offer online. SK out of Michigan wrote, "Thank you so very much. After the video call now, I can get up and down without the dragging pain. I will keep up with these exercises." Tina from North Carolina, and I want to give you a little background on Tina. Tina had multiple level disc issues. She was actually considering flying to Germany to get a multi-level disc replacement, because in the United States, they only do one disc level at a time to replace if they ever want to go in and do that surgery. So Tina had recently spent $3,500 at a chiropractor's office, and actually her pain went from a 5 out of 10 to an 8 out of 10 consistently. She wasn't able to sit. I convinced her to get on a free video consult with me just so I can see if there's anything we can do. And she wrote afterwards, "I was skeptical of anyone claiming to be able to help me. I had seen dozens of doctors who took my money and failed to follow through. You have been the only one sincere enough, and you made me feel better. I'm so glad I took a leap of faith and I found you." If you go on to Sciatica Relief Now YouTube page, you can watch her testimonial. She's almost in tears as she came back from doing the exercises. She walked across the room, came back, sat down, and looked at me and said, "I haven't been able to sit like this in over a year." And she was sitting without any pain. Peggy from Florida wrote, "I had the privilege of talking to Dean today through his webinar. If anyone has any sciatica issues, I strongly suggest you speak with this man. He took time with me, explained things so thoroughly, plus the exercises he had me do took my pain level from a 9 to a 1. I can't thank him enough, so please get in touch with him. No doctors, tests, chiropractors, or exercises help me like Dean did today through his webinar. Peggy had been walking around with a cane. I believe she was dealing with this for about 9 months. Previously thought that she was going to be having to use a cane and or a walker to get around. And after 10 to 15 minutes of working with her, she was walking around pain-free. And like I said, just because she got the quick fix doesn't mean everything was fine. She had to keep up with activities. The activities I gave her, she couldn't do certain things for a while just to try to calm symptoms down. And Becky C. recently wrote on my Facebook page, I am on day 1 after buying the course and doing the exercises. I am now up and moving around, and I had been in bed, resting, laying around for a week because of constant spasms. I am amazed. And now I want to introduce you to a very special guest. This is the first student who took my online course. Her name is Christine Ballestad. She is from New Jersey, but she is now living in Norway. And I want you to hear her story in her own words and how she responded to our techniques. So I'm going to turn this over to Christine. Hopefully this will come on and work like it's supposed to for you. And let me turn up the volume. And here,
This is Christine Ballestad, formerly Christine Salerno. I'm 37 years old. I'm originally from New Jersey, and I'm now living in the country of Norway. This is my story. For 13 years with an ache in my butt like a golf ball that I was sitting on. I felt an electrical shock running through me from my butt all the way down to my ankle that would flare up right before my period and last for 5 days. And I could count on that pain for 13 years coming back to me. I had low back discomfort from an accident. I fell mountain biking, and I constantly was in some state of pain. To relieve my pain that started at age 24 and was continuing all the way to age 37, I had first started out going for MRIs, scans of my back at my regular doctor, chiropractors, exploratory surgery, massage therapy, acupuncture, injections, anything that I could think of, including even physical therapy, many, many times with no results, personal trainers, everything that I could think of to try and relieve my pain, I was trying. I was on medications after medication, anything, just to get relief. During the 13 years of pain, I was trying so much just to get relief. I spent $600 a month on medications, so my insurance would cover some of it, but I had to eat some of that cost as well. I was going in acupuncturist for several months. Every visit twice a week was $50. I was going to massage therapy just to try and relieve some aspect of the pain. Every time I went, it was another $75. Never mind travel costs to these appointments, missed work for pain and for visits and for injections and surgery. I even got to the point, I went to Columbia University to see the doctors that treat the New York Yankees, the specialists for back and hip injuries. And I had to pay the travel costs as well as pay out of pocket several $1,000s for all those visits. And I got nowhere still. To the point that I felt like there was nothing that was going to help me because I was in so much pain. I got depressed. I felt like I'd look in the mirror and I wouldn't even like the person I was because the person I was constantly in pain. How could I like myself when every day I woke up and I felt extreme pain that held me back from family, friends, and cut into my paycheck from work and even made me feel like I had to go on disability? So when I finally got to this point, I started Googling and I got on Dean's Facebook group. And that's when he offered me a free consult. He said, come on and let's do a video consult and we can talk to each other. But my first thought was, I'm a little shy. I don't know if I really want to go on some video chat with someone I don't know. And I really don't think this can help me because I've already tried stretching. I've already been to countless physical therapists. I've even gone to the extreme point of trying surgeries. So I just wasn't getting anywhere. But at the same time, I felt like my life was over. Let me just give myself one last chance to try this out and just see, because it can't hurt. And so when I got onto Dean's video consult, he showed me a very simple exercise. And as soon as I tried it, I started to feel some relief, like my back was unlocking. And I got to the point when I was talking to him and trying this exercise that I realized I was starting to take some small piece of control back in my life just by using this one exercise. And over the next few days, I tried this exercise again and again, the way he had instructed me to do so. And for the first time, I was in control of my experience with my body and with my pain. I could control some small speck of it just by doing this exercise that was so simple. I could even do it in public. And now it wasn't relying on spending my paycheck, my time away from friends and family to get to a point of some type of temporary relief, because that's all I was getting. Now I was able to start to feel a difference in my body that I myself was creating. And I felt empowered by this exercise. So I went to the point and I got involved with Dean's membership site. And I had tried things before like this, and I had gotten nowhere. It was just simple exercises I'd seen a million times before. But this was different stuff. It was a different approach that was finally working for me. To review my symptoms, from age 24 up until the present of age 37, 13 years, I could count on having a pain in my low back. I could count on having a constant tightness in my left glute like I was sitting on a golf ball. I could count on having that extreme electrical shock sciatic pain running from my butt all the way down to a tight ankle 5 days in a row right before my period. And I felt like, okay, there's nothing I'm going to do to be able to get some relief. I went to doctors that told me the only way I could possibly get relief other than being on constant pain medication after everything I had tried was a chemical menopause. They said, if you don't have the hormones in your body as much, maybe you won't feel pain, but it's irreversible and you're a young person still. But when I got to week 9 with Dean, first week into the program, I started having zero low back pain. I had a bruised feeling in my back for 13 years. I felt like someone had kicked me back there really hard and it never stopped hurting. I couldn't even have someone touch my low back. It's been gone all these 9 weeks after that first week. The second thing I noticed as I got through the first cycle of my menstrual period, I still did have some electrical shock pain as I was working through my body. But now as I work through that second cycle, I have zero pain whatsoever. From 13 years of extreme pain where I felt so depressed just getting out of bed to zero pain. And I know it seems like, well, that's a short time, 9 weeks, maybe it'll come back, it's too quick. But the difference is if you've been living for 13 years with pain and all of a sudden something you're doing starts slowly unraveling that pain in your body and you can see the results in the way you walk. I can look at my new pair of shoes and see I'm not wearing them out the same. I can feel like there's a difference in my body and I myself am in control of it. I'm not depending on sitting in a doctor's office waiting to get my shot or my pill constantly. I'm not depending on anything anymore except the tools that Dean has taught me through his membership site that I'm now able to learn and use and carry with me wherever I go. So I don't need to have pills in my bag anymore. I don't need to run to these office visits every time I'm in pain. Stop, go to the acupuncture, go get a massage. No, just stop for a moment and do my stretch that he taught me. And I can relieve it myself and control it, but also see myself walking better, see myself balanced more, and see not only stopping pain, not putting a Band-Aid on it, but working towards a path of healing and feeling that difference in my body. I'm excited about each day that I wake up because it's another day I'm getting stronger. When I used to feel like it's another day, I don't even want to be here because I can't deal with the pain anymore. The membership site has provided me with a totally different outlook on life. It's relieved me not only of my pain, but of the depression that comes with having chronic pain that I know so many of you know and feel. It's like a feeling of finally, I look in the mirror now and I'm in control of myself and I have a life and a future that's pain-free.
I hope that story resonated with you somewhat. And now I just wanted to read to you from Terry Chadwick from a Facebook post. She is a personal trainer from Scottsdale, Arizona. She recently joined my online course, my membership site, because she was dealing with piriformis syndrome. She said, I'm on week 7 of the SRN, which is Sciatica Relief Now course, and it's definitely working. I don't know how I got piriformis syndrome and the painful sciatica that came along with it, but I have definitely improved since starting the course. I'm now getting out of bed in the morning almost pain-free, whereas at the outset, I would stoop over and walk to the bathroom to start my day and achingly go about getting ready. I immediately do the prescribed set of 1 exercise and 1 stretch that have really worked for me while sitting in a chair by my bed. It's become a satisfying little habit because I know I'm going to move better into my morning routine once I've done it. I've started back to lifting weights. I lift heavy, a passion of mine, though I'm practicing restraint and I do not do anything that will intentionally irritate or stress my left side. I've actually gotten stronger in my upper body by focusing away from doing anything painful. I'm pretty stoked about that. I've also recently started going to a yoga class once a week. Again, I stay away from doing anything that stretches or strains that left side. It's such a blessing to know how to and not to move my body according to the guidelines that Dean has put forth, learning and then being able to apply these principles and watching their effectiveness. It's been very empowering for me. I find myself wanting to tell the world. P.S. I've started using these exercises and guidelines with pretty much all of my personal training clients, some for knee pain, some for shoulder pain, etc., and they are seeing immediate results. We're going to lick this thing by God because the Sciatica Relief Now program works little by little and not overnight, but we're going to get there and we're going to stay there too, healthy, mobile, and doing the things we love to do once again. That's from Terry Chadwick, a personal trainer. So my question to you is, are you serious about getting the help you need and deserve? What would your life be like if 50% of the symptoms were alleviated today? Are you ready to start living with less pain? Did you see or hear anything today that makes sense, that's a little bit different? Do you want to find the same relief as thousands of my other clients have over the past years? Are you as dedicated and passionate about taking your life and health back as I am about helping you achieve that? If so, I have an offer for you to take advantage of today. An offer for you, but only if you are sick of feeling like this. Instead of what you should be feeling like. Being active, moving around, not fearing the pain, and not being hunched over. Time is up. Let's get rid of this. Let's get you on the road to recovery. So for those of you who have stuck with me and are watching this, I am offering you a 30-minute free video consultation / interview because I want to hear your story. I want to help you sort some things out. I want to give you some advice and an exercise or two to show you the effectiveness of my methods. There's no strings attached. There's no obligation for anything else after that. It's just my way of saying thank you for watching and taking time to participate in my webinar. I call it an interview too because number 1, I want you to learn more about me. And number 2, it's for me to see if you actually qualify to become a client of my program because we do not accept everyone who asks to come in. I'm looking forward to getting to know you, your story, and learning if we are a good fit for each other. So you might be asking, what's the next step that I need to take? Very simple. If you are serious about wanting to get on the road to recovery, and if you're wanting to apply to work with me and my course, or if you feel you can just benefit from chatting with me, simply click the blue box below that says, click here to request your free video consult / interview. Fill out the following form. That will email me, let me know that you are interested in getting together with me, and we will email you, get in touch with you as soon as possible, maybe give you a call if you leave your phone number so that we can set something up on the schedule as soon as possible. So with that, I just want to say thank you, thank you, thank you for putting up with me for nearly 50 minutes, actually right at 50 minutes now. I am sincerely grateful that you took this time out of your day to watch this. I hope it gave you a little perspective. I hope it added some hope. I hope you gained some knowledge so that you can move forward from here knowing exactly what you need to do to get you on the road to recovery. And once again, if you're interested in applying to work with us, please click that box below, fill out the form, and we will be seeing you soon. Thanks again. Have a wonderful day, and I so look forward to meeting you in the future.